Antibody testing for COVID-19 is becoming more readily available, but there are still multiple unknowns about what the test results actually mean when it comes to public health. I recently spoke with ProPublica health reporter Caroline Chen to help explain some of the confusion. Caroline, thanks so much for joining us. There's been such an intense focus on antibody tests, both here in the US and overseas, but not without controversy. And some of the methodologies that are used in the studies have been questioned as well for bias and sort of other elements that can, sort of sway results. So how reliable are these tests and how dangerous is a false positive?
Yeah, so there are many questions you asked right there. So let me break this down a little bit here. So antibody studies that are now being conducted nationwide at state levels and even at county levels are really, really important because they can actually answer many questions. But the most common type of study that's being done right now is to ask this very basic question, which is what percentage of this population has been infected? And what they're doing is that they're supposed to look at a random sample of a given population, let's say in this specific county or in this specific state, and by taking a random selection of the population and looking in their blood to see if they have antibodies, you can get a sense of what portion of that population has been infected. And that's really important because to date, as we know in the US, there has been a shortage of the diagnostic test. And so only really people who have had really severe symptoms, who have gone to the hospital, have managed to get tested. So we know that the case counts are probably an undercount, but we don't know how much of an undercount. So that's where these studies can help to fill in our understanding. So you mentioned that there's been some controversy about these, and they're kind of maybe two big pieces of this. So the first thing you said is accuracy of the tests, right? So if the tests aren't super accurate, then of course that can skew the numbers. Everybody understands that part. The other trickier part is what you mentioned, which is bias. And what scientists mean when they say bias is that they mean that they're worried that the sample that was tested wasn't totally random. And there are many different ways you can recruit participants, but basically the concern is if you're saying you volunteer, whether I'm recruiting you by Facebook ad or whether I'm just posting something on the internet and saying, email me if you want to participate, that the fear is that people who think that they have been infected, who say, oh, I had a flu back in February, or I had a cough back in February, they're more motivated to participate. Whereas if I say, oh, I've been totally healthy this whole time, I don't think I had the coronavirus, I'm gonna not wanna participate. And that could skew the numbers. So the ideal way to do this type of study is to have a database of addresses and then to randomly pick addresses and then invite people to participate.
And the results of who has the antibody and who doesn't, there's a vast range of differences. I've seen numbers as low as 2% all the way up to 30%. So how do those numbers compare to so-called herd immunity and the metric that they're looking for that?
I think as these numbers have come out, whether it is down at 2% or whether it is up at 30%, which was in Chelsea, Massachusetts, I think a lot of the headlines people are seeing go along the lines of, there are far more infections in our community than were previously thought. And I think that is true. So then some people start to say, so are we actually close to herd immunity? And herd immunity is the idea that when the vast majority of the population is infected, that the virus will not have enough new potential carriers to infect, and so it will stop circulating. Now, I think it's really helpful to just keep some numbers in your mind. So I've asked a lot of scientists, how many people need to be infected for there to be herd immunity? And I've gotten a range of answers, but the lowest number I've heard is 60%. Most people say 70 to 80%. I've heard as high as 90%. The reason why that's not a fixed number is because it depends on a number of different factors, like how contagious exactly the coronavirus is, and also this still open question of if you have been infected, are you then immune forever, like the chicken pox? Or right. Does your immunity actually start to wane over time? All the studies that have come out in the US, regionally, we're nowhere near herd immunity.
Right.
So unfortunately, I think the only other way to get to herd immunity is via vaccine, and that's also some ways away.
So much of this is uncharted territory. When do you think it will be possible possible, taking all these snapshots to put them together and get some sort of sense of where we actually stand as a country, how many people have the antibodies, and when we can start sort of thinking about as a whole country going back to work and feeling much safer?
I think that actually we're going to be able to get a good sense regionally, and sort of maybe potentially at a county level, even within weeks, because there are some counties like Miami-Dade County that are already doing this on a weekly basis. And in New York State, where they are already updating their numbers because they are doing this on a weekly basis. So I think, you may not have a perfect picture already, but you are already starting to have a picture that is becoming more and more in focus week by week as you do this. And I think that's very hopeful because we can get more and more information as we go, even if it's not yet perfect. And learning the proportion of people who are infected in the population is so important for us to better understand the coronavirus and also to get a sense of how fast is this disease spreading. Like, these are all important pieces of information, both for scientists to understand the virus and for politicians to get a sense of what's happening in their city as they make decisions on things like, should we reopen? How fast should we reopen? Are the social distancing measures helping? And also, they'll start to do these studies in select populations, like what portion of healthcare workers or frontline workers, like grocery store workers, are infected. Like, all these pieces of information start to help build a better picture, regionally, statewide, countywide, and then maybe put them together to get a picture of the nation.
Caroline Chen, ProPublica, thank you so much.
Thank you for having me.